let's talk about what you're doing there, because it's one of the reasons why I was so motivated to get your brain back, because you're doing great work, man. Including let's start with the ozone. Why not? Because I just on episode 285, I talked about ozone, and so many people wrote in, well, where can I get these 10 pass ozones? We talked a lot about the high powered ozone, and pulling out the blood, pushing it back in. That's what 10 Ps is. You can give them a little review and then talk about some of the things in your office that you're doing this ozone for.
Yeah. So I've been doing ozone for about 2.5 years right now. And initially I was exposed to ozone by actually a family friend, John Stockton, who's obviously one of the best all-time basketball players. Super nice guy. But anyways, I'm so grateful, because then I spent some time with Dr. Jason West down in Pocatello, Idaho.
I love Jason. I was just with Jason a few weeks ago.
Yeah, great guy. And then I ended up last May, I went to a conference with Dr. Schallenberger, who's kind of the godfather of ozone in the United States. He's been doing it for years. And so once I went to that course, I started doing a lot more systemic ozone, such as, rectal ozone for liver function, just ozone topically, limb bagging for infections. You can use ozone oil for different, skin ailments. The main thing we use it for,
just so people know, if you don't know what those things are that Doc just mentioned, episode 285, we talked all about all of those things. And now you have a place to actually go to get it done. So go ahead, Doc.
Correct. And so the main use we have for ozone, because we primarily treat musculoskeletal injuries here, and now we're getting more into the detox, anti-aging side of things, is for musculoskeletal injuries. So for example, somebody comes in, they tweak their knee, they're like, oh man, my knee's hurting me. What we do, what makes us different, is that we're trained in diagnostic ultrasound. So we're able to actually, in combination sometimes with MRI and or X-ray, we are able to diagnose their knee with diagnostic ultrasound. And so sometimes we'll actually pick up, other tears and maybe their patellar tendon or their MCL that sometimes even the MRI miss. And so by doing that, we'll be able to get a better, more holistic picture of exactly what's going on with the patient, what the injury is, and how we can actually help them. So then what we do is we use ultrasound guided injections, right, to guide the needle right exactly where the injury was. And then we inject it typically with the procaine solution, or we'll use stem cells, placental tissue matrix, PRP. We have a lot of different concoctions that we need to use, or we can use, depending on what the patient wants, how quick we want to get them better. But then what we do at the end, we add on the ozone. And the ozone just gives more horsepower for whatever we're using.
Yeah.
So, for example, Hoop Fest, I played a 3-on-3 tournament, tweaked my right knee and injected my knee with ozone the next day, it was actually, and then immediately felt better within 2 days. So I've seen some phenomenal results with it.
Yeah, my ozone machine staying right over there. I was just telling you a story how I used it yesterday. It's like I use that thing constantly. I just ozone is amazing. But the 10 pass, man, I mean, this is how you really push. I mean, you're taking out your blood, you're basically mixing it and putting it back in 10 times, right? I mean, that's the whole 10 pass. But what that does for your immune system is just amazing in general.
Yeah, so Dr. Lahotny is one of the physicians over in Austria who has the most experience using the 10 pass, and he's been doing it for, I think, at least 5 years. And so at his clinic, that's mainly what they do. They treat people with 10 pass. So he'll have these people that have these non-healing ulcers, chronic infections, and some of these patients get better within 48 hours. For people that are a little bit more chronic, such as people with Lyme, MS, Parkinson's, he's actually had really good outcomes with a lot of these patients with ongoing treatment. So these people that have more chronic conditions such as Lyme or any kind of like Epstein-Barr, chronic viral infections, they typically need more like 10 to 20 treatments. but some of these responses in some of these cases are just miraculous, how much better they get improving. What it does is it balances out your immune function, and it upregulates what he's found from what he's done, upregulates and activates your stem cell production, and then also upregulates and activates your mitochondrial function, which are all great things.
Yeah, which when I get it done, I feel amazing for days on end. So obviously it benefits the healthy person or someone struggling, to your point. All right, well, you do a whole heck of a lot more. Tell us about the ultrasound guided neurofascial, basically therapies that you are hydrodissection, as you call it, as well.
Yeah. So this is kind of a term that kind of combination of Dr. Stan Lamb out of Hong Kong, Dr. Tom Clark, who's kind of all of our teachers, who's a guru at ultrasound, excellent skills, and one of my colleagues who has taught me a lot, Dr. Sean Tierney. Kind of a backdrop before we kind of go into that. I'm part of an organization called MSKUS, which is an organization that helps teach physicians, other care providers, how to do ultrasound guided injections, how to do diagnostic ultrasound, and they're largely the reason why I know how to do this, and I'm very grateful for all they've taught me. And so what ultrasound guided neurofascial hydrodissection is we're actually finding where nerves actually get trapped by the connective tissue from a trauma, repetitive use. There's numerous different things that can happen with that. And so what happens is with the ultrasound, we're able to actually see where that nerve's being compressed, and we're able to guide a needle very specifically and precisely right above and below. And what we do is it's called hydrodissection because we're actually using fluid to dissect out those fascial planes, both above and below. So we create this space, this halo, we call it, over the nerve. And then we're able to scan up and down the nerve to make sure that halo is complete. So it works great for things like carpal tunnel syndrome, any sort of nerve entrapment, lots of neck pain, people that have neuromas. I mean, they're endless. I know we'll talk more about the different indications within this talk, but I've been amazed at some of the outcomes. For example, we just had a patient today who was in a really bad rear end car accident. She ended up hurting her whole left brachial plexus, upper thoracic spine, lower cervical spine. And now she's a NICU nurse, and she has a difficulty gripping her fingers. And so today I tested her, and she was probably 4+, 4 out of 5 strength. And so she couldn't quite hold those fingers strong all the way tight. So what we did is we ultrasound guided hydrodissected her brachial plexus up in her neck. We came down and we found that one of her painful spots is where her median nerve, which is the nerve that allows you to grip, at her elbow was hurting and inflamed on ultrasound. And then also there's another spot at the pronator tunnel that were all inflamed. So what we did is we ultrasound guided, we hydrodissected brachial plexus first. Her grip was still about the same. Then we ultrasound guided and hydrodissected the brachial or the median nerve at the elbow, and immediately she had 5 out of 5 strength, like no change at all, no differences side to side. And then we just because I thought she needed it, we also did it at the pronator tunnel. So being able to use the very specific and precise ultrasound to guide that needle right where that nerve entrapment is, you can get some phenomenal results with patients.
Wow. How long has it been around? I mean,
it hasn't been around really long, and I'm pretty sure Dr. Clark is the one that kind of started it. Mm-hmm. So knowing him, he probably started dabbling like 20 years ago. But as far as I would say only the last 5, maybe 10 years, it started to become more popular because people are realizing how valuable it is and how well it works and how few side effects. I think one of the coolest things is that the injectate that we typically use, so the solution we typically inject, is 5% dextrose, which is very benign. It's not like steroids. It's very safe. It's very affordable as well. And so I think that's one of the things that makes it a very valuable treatment, is that you can start with 5% dextrose, and then eventually you can go up to PRP or exosomes or things like that if needed.
Yeah, so it's inexpensive. It's a great place for people to start. Like you said, instead of jumping right into stem cells, or exosomes, it can be used for other things besides neuropathies and nerve-related things. I mean, can it just be used for arthritis? Can it be, what else are you using it for?
Yeah, that's a great question. So we have several patients who they're scheduled our hope is they don't have to have knee replacement surgery, but that are scheduled for knee replacement. They said, hey, can you just help me like for 6 months get through this? And what we'll do is we'll do ultrasound guided hydrodissection along the nerves, along the medial aspect of their knee. Because what happens is that those nerves along the inside of your knee, they actually get stuck on those bone spurs. And so those bone spurs are actually irritating those nerves. So what we do is we go and actually dissect off those nerves and kind of create those fascial planes, create space. And a lot of times they'll get up the table immediately and say, oh, that feels so much better. And sometimes they don't need any surgery because you're taking care of their pain, even though their knee might still might not look, amazing. And so we use it a lot of times in combination with, the different like stem cell based treatments or, PRP regenerative treatments, just because it's a really important adjunct. And I have had some patients who have had, regenerative treatments that they're not actually responding as well as far as the pain. And what they've been missing is the hydrodissection. And so I think that's a very, very crucial, important part of the actual, diagnosis and treatment of all these musculoskeletal problems.
Yeah, that's interesting, because now, okay, so fascia, it lays under our skin against our muscle, right? It's like the turkey, that you take the skin off the turkey, that like gelatinous connective tissue underneath there, just so people understand that this fascia. Can you use it just for because I know that fascia after injuries becomes a problem. I mean, can you do it with just the fascia on the muscle as well?
Yeah, so that's why we call it neurofascial hydrodissection, because in some cases we're actually specifically going right around the nerve. And a lot of times you have these little sensory nerves that you can't even see within the connective tissue. So let's say that somebody had a trauma where, let's say a chair or a table fell on a leg. And what happens is they have direct tissue trauma to that area. So what you do is you actually guide the needle underneath that tissue and you separate out those fascial planes where that trauma has occurred. And an example for you would be a patient we had today who has had a hip replacement surgery and has this huge scar on his lateral thigh, so the outside of his thigh. And he came in just had horrible hip pain since his surgery. So after 3 treatments, he's already doing significantly better. He gets off the table and you could tell how much more comfortable he is, just because we're able to actually guide the needle right where that scar tissue is, and we break that up. And then the cool thing is that we also do, because we're trained in using ozone, is that after we hydrodissect, a lot of times what I've been doing recently is like adding low concentration ozone, and I've been seeing some amazing results with people and nerve regeneration, helping strength, helping get rid of tingling. But yeah, it's a great combo.
Yeah, I know. I mean, when people get their scars injected just with Procaine, I mean, they go, oh my gosh, it like transformed. Could that be part of the reason is you are separating that fascia off of the scar?
Correct. Yeah. And that's what I found. I had a patient who, I like to use patient examples because I feel like they paint a better picture. I had a patient for about 10 years after she had a lumbar fusion. She had this lower abdominal scar, and she had lymphedema or swelling of her lower extremities, more so on the left side. After 2 treatments, and all I did is I went deep into her scar tissue, up in her lower abdominal region, and injected 5% dextrose. And I believe I used a little bit of ozone there. After 2 treatments, 85% improvement in her lymphedema that she's had for years. And she's been to like the best therapist. She's tried everything she could use. And so I think it just shows you a lot of times the scar tissue and these fascial adhesions actually are affecting the lymphatic flow and just your neurovascular system as a whole.
I couldn't agree more.